If you get Social Security benefits, or you're planning to apply soon, things are changing fast, and you need to pay attention. We're talking about massive staffing cuts, backlogs affecting millions of people, and new rules that could make simple tasks much harder if you don't know what to expect. Whether you're retired, on disability, or helping a family member navigate the system, what's happening right now could affect your benefits, your wait times, and your ability to get help when you need it most. So today, I'm breaking down exactly what's changed, who's being affected, and what you can do to protect yourself going forward. Before we dive in, let me ask you something. Have you tried calling Social Security recently? Or have you had any trouble getting through to them? Let me know in the comments. I'm genuinely curious how many of you are dealing with this. My name is Tony, and here at Retirees Benefits, we've been helping people navigate government benefits for a year. I've personally walked hundreds of people through Social Security applications, appeals, and confusing policy changes. I know how overwhelming this system can be, especially when you're already struggling financially. Social Security isn't just one program. It's a massive operation that serves about 74 million Americans. That includes retirees, people with disabilities, survivors, and folks signing up for Medicare. Every month, millions of payments go out, millions of questions come in, and millions of records have to stay accurate. For a long time, that machine ran quietly in the background. You didn't think about it unless you needed it. Now a lot more people are thinking about it because the machine is showing signs of strain. Here's where things start to get complicated, but I'll keep this simple. Since President Donald Trump began his second term in 2025, the Social Security Administration has gone through rapid changes. The administration partnered closely with the Department of Government Efficiency, often called DOGE, led by Elon Musk. The stated goal was pretty straightforward: reduce waste, modernize systems, and crack down on fraud. On paper, those goals sound reasonable. Most people agree that government systems should be efficient and secure. The trouble is how fast and how aggressively these changes were rolled out. Nearly 7,000 Social Security employees left the agency in a short period of time. That's about 12% of the entire workforce. Some were laid off, others took buyouts or early retirement. And here's the thing, these weren't just entry-level workers. Many of them had decades of experience. They knew the rules, the exceptions, the odd cases that don't fit neatly into a computer system. When they left, that knowledge walked out the door with them. At the same time, demand didn't slow down. In fact, it increased. Baby boomers are retiring in large numbers. Disability claims are complex, and Medicare enrollment isn't getting any simpler, so you ended up with fewer workers handling more cases. And that's where the backlog started piling up. Internal documents showed as many as 6 million pending cases in processing centers and around 12 million unfinished transactions in field offices. Those numbers aren't abstract, they represent real people waiting. Now, maybe you've heard about the long phone wait times. At one point earlier this year, the average wait was about 2.5 hours. That's not a typo. People would call, put the phone down, make lunch, come back, and still be waiting. Management responded by pulling workers from other departments and putting them on the phones. The problem was, many of those workers didn't get much training. Some employees described it as being told to just figure it out. That helped bring the average wait time down on paper, but it created new problems elsewhere. You see, when someone spends all day answering phones, they aren't processing claims, updating records, or reviewing documents. So the calls got answered a bit faster, but the actual work backed up even more. One union leader summed it up simply: that work piles up, and once it piles up, it doesn't magically disappear. Another major change involved fraud prevention. Again, the goal sounds reasonable. Nobody wants benefits stolen, but the way it was implemented caught a lot of people off guard. Certain actions, like changing direct deposit information, can no longer be done over the phone. In many cases, you have to do it online or in person with stricter identity checks. That's fine if you're comfortable with computers, have reliable internet, and can easily travel. But for many seniors and people with disabilities, that's a tall order. There was one case that really stuck with me. A 75-year-old man had suffered a massive stroke and couldn't drive anymore. He changed banks and needed to update his deposit information. He couldn't go online and he couldn't get to an office. The employee on the phone wanted to help him, but under the new rules, her hands were tied. She ended up telling him to ask a relative or call his bank instead. You can hear the frustration in stories like that on both sides of the line. And this isn't rare. Field offices have been crowded. Appointments are hard to get, and people are often told to come back weeks later. Some folks show up because the website didn't work for them, or because they didn't understand the online system, only to find out they still can't resolve their issue that day. Imagine being close to a deadline, maybe for a driver's license or medical coverage, and being told to wait again. If you're a senior and Social Security is your main income, these delays and barriers hit hard. About 40% of seniors rely on Social Security for at least 90% of their income. When you can't update your direct deposit or get through on the phone, that's not just an inconvenience. It's your rent money, your groceries, your medication. If you're on Social Security Disability Insurance, SSDI, or Supplemental Security Income, SSI, you're dealing with the same backlogs and new rules. Disability claims are already complex, and now they're taking even longer to process. Some people are waiting months just to get an initial decision. If you live in a rural area and your nearest field office is hours away, in-person requirements aren't just inconvenient, they're a barrier. Some people rely on neighbors for rides or simply give up. That's a very different experience than someone who lives 10 minutes from an office and uses a smartphone daily. If you're a single mom receiving survivor benefits for your kids, or if you're caring for an aging parent who depends on Social Security, these system problems ripple through your entire household. You're already stretched thin, and now you're spending hours on hold or driving to appointments that get rescheduled. Many veterans rely on Social Security in addition to VA benefits. If you're a disabled veteran trying to navigate both systems at once, the added complexity and delays can feel overwhelming. Leadership instability hasn't helped. In a 6-month span, the agency went through 3 acting commissioners. Policies were rolled out, reversed, and then adjusted again. Regional offices were eliminated in a rush. Employees were reassigned repeatedly. One former acting commissioner even admitted that he flipped the switch knowing there would be casualties and described the agency as being subject to political whims. That kind of uncertainty makes it hard for any organization to function smoothly. Eventually, a permanent commissioner, Frank Bessignano, was confirmed. He authorized overtime and emergency measures to deal with the backlog. The agency says it has reduced processing delays by about 1 million cases and cut disability backlogs significantly. That's real progress, and it's worth acknowledging. At the same time, independent audits showed that some of the improved phone statistics were misleading. Calls counted as having 0 wait time often involved callbacks that took an hour or more, so the experience didn't always match the numbers. Okay, I know this all sounds pretty grim, but there is some good news mixed in here, things that aren't getting enough attention. The agency has made real progress clearing the backlog. About 1 million cases have been processed, and disability wait times have improved in some regions. It's not fixed yet, but the trend is moving in the right direction. Despite all the turmoil, the core function is still working. Benefits haven't stopped. Checks are still being deposited. The friction has increased, but the system hasn't collapsed. Most of the people inside Social Security still care deeply about helping. Many of the delays aren't because of indifference, but because the system they're working in is stretched thin. Remembering that doesn't fix the problem, but it can help explain why things feel the way they do. If done right, modernizing systems and addressing fraud could make Social Security stronger and more secure for the future. The question is whether the execution matches the intention. Let's talk action steps. Here's what you can do this week to protect yourself and your benefits. If you're approaching retirement or helping a family member, start the process early. Give yourself extra time for delays. The old rule was to apply 3 months before you need benefits. Now consider making it 6 months. Keep records, confirmation numbers, and copies of everything. Write down the names of people you speak with and the dates. If something goes wrong, this documentation is your lifeline. Go to ssa.gov and create a My Social Security account if you haven't already. Even if you prefer in-person help, having online access gives you more options when offices are backed up. If something feels off, don't assume it will fix itself quickly. Follow up, call back, send letters, be persistent. I know that's frustrating to hear, but right now, squeaky wheels are getting attention. If you're stuck, reach out to your local congressional office. They have staff specifically trained to help constituents with Social Security issues. You can also contact legal aid organizations or advocacy groups like AARP. Subscribe to this channel so you don't miss updates. Things are changing fast, and what's true today might shift next month. Being informed gives you power. So stepping back for a moment, the big picture is complicated. The administration's goals, efficiency, modernization, fraud prevention, are real goals, but the execution has created real pain for real people. There's also a political divide in how people interpret what's happening. Critics argue that the agency has been weakened on purpose, that cutting staff and pushing everything online makes the system less accessible, especially for the most vulnerable. They worry this is a step toward shrinking the program further down the road. Supporters of the administration counter that modernization is overdue, that fraud has to be addressed, and that short-term pain is unavoidable if the system is going to survive long-term. They see this as a necessary reset. Whether this leads to a stronger, more accessible system or one that feels distant and harder to navigate depends on what happens next. Public reaction has been intense, and honestly, that makes sense. Social Security isn't just a policy debate. It's rent money. It's groceries. It's whether someone can afford their medication. People talk about spending entire mornings on hold, about kind but overwhelmed employees apologizing for delays they can't control. Some are angry, others are scared, and many are just tired. What worries many people the most is trust. Social Security is built on a long-term promise. You pay in for decades, expecting that the rules will be clear and the system will be there when you need it. When policies change quickly, when guidance shifts, that trust erodes. And once trust is gone, it's hard to rebuild. But here's what I want you to remember. You are not alone in this. Millions of Americans are in the exact same boat, and there are resources available to help you. Whether it's programs you didn't know you qualified for, strategies to protect your benefits, or just a community of people who understand what you're going through, help is out there. The system might feel rigged against us sometimes, but knowledge is power. When you understand what's happening and you take action, you're giving yourself the best chance to make it through these changes. If this video helped you, please hit that subscribe button and turn on notifications. We're going to keep covering Social Security updates, benefit programs, and practical advice for people who are struggling financially. And if you haven't shared your thoughts yet, feel free to add to the discussion in the comments. When you think about Social Security right now, do you feel mostly calm or mostly uneasy? Hearing how others are feeling really helps put this into perspective. Check out our other videos on Social Security strategies and benefit programs. I'll link some in the description. And remember, you've worked hard your whole life. You deserve dignity, security, and a system that actually works for you. This moment matters, and paying attention now can make a difference later. Thanks for watching, and I'll see you in the next one. Stay strong, stay informed, and take care of each other.